Bismillahirrahmanirrahim ji, this is the scariest drug you will never see on a talk screen. It makes men throw cars, fight policemen, and when you test for it, it laughs at your lab results. Let's see what I'm talking about. A 20 years old man is brought to the emergency department by police after he was seen running into the traffic and smashing windows with the bare hands. He's extremely combative, requiring 5 staffs to restrain him. Okay, blood pressure is 185 over 95, heart rate is 138, reflexes are 3 plus bilaterally. Urine toxicology screen is negative. Okay, look at this. Urine toxicology screen is negative. He's given benzos. Psychosis resolves over 48 hours. Okay, what is the most likely cause? Let's go through every option. Option A, brief psychotic disorder. Why is this wrong here? Look at his vitals. Here I want to tell you one rule related to psychiatric disorders. Wherever you see psychiatry, you do not see autonomic symptoms. Blood pressure not elevated. So when your brain does not spike your blood pressure to 185 just from thinking differently, if it's something related to psych, schizophrenia, schizophreniform, schizotypal, histrionic, borderline, whatever it does not cause increased vitals. Okay? It does not cause increased vitals. So, brief psychotic disorder, although I know you guys must be thinking that urine tox is negative, then why don't we select this option? The fact here is, I'm going to tell you a golden rule. Between psychiatry and between substance abuse, how are you going to differentiate? The differentiating feature is just one. Whenever you see a conflict between these drugs, cannabis, cocaine, LSD, phencyclidine, and they also give you this brief psychotic disorder, what are you going to choose? Because symptoms almost match. What are you going to choose? You have to look at just one thing. Just look at the vital signs. Blood pressure increased, heart rate increased. That means there has to be something which is inside the blood. Okay, which is inside the blood, which is actually causing these symptoms. Only psychiatry, only these psychotic disorders do not cause this much spike in the blood pressure. Brief psychotic disorder eliminated. Okay, the second one. Why is this wrong here? The cannabis intoxication. First of all, urine tox screen is negative. Tox screen is negative, and cannabis stays positive for 30 days. It never hides from your labs. And cannabis does not make you fight 5 policemen. So when would cannabis be correct? For cannabis, I just want you to remember one word. One word that will actually help you, and you will always see it in the vignette if cannabis is the correct answer, and that is conjunctival injection. Conjunctival injection. You're gonna see red eyes. If you see red eyes and you see also cannabis there, okay, you're considering this option. Okay. Other things, slow heart rate, increased appetite, of course it's a stimulant, paranoia, dry mouth, euphoria, and most importantly, tox screen will always be positive. Tox screen will always be positive. Here it is negative, eliminated. So we have successfully eliminated 2 options. Now we're going to move to cocaine. Okay, why is cocaine? First of all, it is the wrong answer. It is the wrong answer. Why is this wrong? Cocaine is a sympathomimetic. Hypertension, tachycardia, agitation. Looks tempting. I know it looks tempting. But cocaine always, and by always I mean always, shows up on the tox screen within hours. Here the tox screen is negative. Just rule it out. I told you, cannabis shows up on the tox screen. It's not present here. Cocaine shows up on the tox screen, not present here. Why did I rule brief psychotic? Because I'm seeing autonomic symptoms. Wherever I see autonomic symptoms, psychiatry just goes out of the house. Okay, when would cocaine be the correct answer? Cocaine would be the correct answer if nasal septum perforation occurs, chest pain, MI, dilated pupils. These are the buzzy words that you're gonna see when cocaine is when they want you to choose cocaine as a correct answer. Okay, tox screen positive. Option C, eliminated. Now we have this LSD intoxication. What about LSD? For LSD, I just want you to remember one word. Just one word. If you don't see this word in the stem, it's a wrong answer. And that is hallucinations. Hallucinations. Wherever you see hallucinations, and specifically the visual hallucinations, Visual hallucinations. Patient will say, I'm seeing geometric patterns, I'm seeing melting walls, I'm seeing, pink elephants, brown rhinos in my imagination, or whatever he's calling it, or whatever he's seeing it. But he'll actually see it in his thoughts, okay? If you don't see LSD, if you don't see if you don't see, what was I calling, hallucinations. If you don't see hallucinations, LSD is the wrong answer. Remove it, okay? Eliminate it. Now we have these two options, and these are the most confusing options and confuses most of the students. Okay. For phencyclidine, we have actually remembered that phencyclidine is a kind of drug that actually causes extreme aggression, psychosis, hypertension, tachycardia, hyperreflexia, seizure. This looks identical to our patient. But the thing is, that's the wrong answer. Why is this the wrong answer? There are two reasons for it. First, the way I told you that for LSD you have to remember hallucinations, for phencyclidine I'm gonna tell you another word, and that's very buzzy. For phencyclidine, if you do not see nystagmus, I don't care about horizontal, vertical, rotatory, multidirectional, whatever it is. Sorry. If you do not see nystagmus, phencyclidine is the wrong answer. They will never fool you into not giving it or hiding it in the vignette. They will never do this. They will always, NBME, 10 out of 10 times, they give you nystagmus with phencyclidine. And secondly, PCP is something that always shows up on the talk screen, and so is LSD. These four, you can just rule them out in just 20 seconds if you actually know that they all show up on the talk screen. Then you have a competition between brief psychiatric disorder and the bath salts. First of all, I want to tell you what are bath salts. These are synthetic cathinones. These are man-made chemicals, and they actually mimic cocaine and amphetamines, but they are 10 times more destructive, okay? The street names are usually Falaka, Cloud9, Ivory Wave, or whatever you call it, but they cause extreme aggression. They cause psychosis, superhuman strength, banging 5 people out of the house, and, hyperthermia. Maybe you think that this patient is possessed with demons or whatever you call it, but there is no such thing as possession in science, okay? So just think about that. And here is the terrifying part. The most terrifying part that actually makes this question interesting. Standard talk screen test, they test a very fixed list of known substances: opioids, cocaine, cannabis, amphetamines, benzos, PCPs. Synthetic cathinones have a completely different chemical structure. And by synthetic cathinone, I mean the bath salts. The labs were never built to find them. So your patient is on the most dangerous drug on the street, and your talk screen smiles back at you and says, I am normal. Option F, synthetic cathinones or the bath salts, whatever you call it, this is your answer. I'm gonna revise every option for you once more and just tell you the buzzword for it and what would make it correct. If you see red eyes, that's your correct answer, the cannabis. If you see stressor in the history plus normal vitals, that's your correct answer, the brief psychotic disorder. And if you see chest pain plus nasal symptom, nasal perforation, whatever you call it, cocaine is your correct answer. Whenever you see hallucinations, LSD is your correct answer. Whenever you see nystagmus, phencyclidine is your correct answer. Superhuman aggression plus psychosis plus negative talk screen, bath salts every single time. So next time your talk screen says normal, do not celebrate. Ask yourself, what am I not testing for? What am I not looking for? That's how you think about the step 2 CK patterns. See you tomorrow with another trap.